Hi everyone, Dr. Andrew Orr here. I'm coming on today to talk about a topic that a lot of people often ask me about. One of the things that we often have to talk to people about is that when they've done all the conservative measures, that sometimes surgical intervention needs to take place, especially for things like endometriosis, where the definitive diagnosis comes about through surgical intervention and using a laparoscope to go on and see if there's any active disease. Now, one of the things people often get a little bit worried about is that what if they don't find anything? Is it all in my head and am I going crazy and things like that? And I have to explain this to people because, more often than not, when you have symptoms of period pain and pelvic pain and pelvic rectal pressure filling, IBS-like symptoms and things like that, it's very indicative of endometriosis. And there's clear-cut signs and symptoms and so forth. The same with adenomyosis. There's very much the same similar symptoms as endometriosis, but generally speaking, you get a lot more bleeding symptoms with adeno. Adeno often can't be seen by a lap, not always. It can sometimes, depending on how bad it is and a couple of situations, but usually adenomyosis is either diagnosed through an MRI, and even then sometimes it might be missed as well. It just depends on varying factors. But endometriosis and things like that and other forms of pelvic pain like pelvic congestion syndrome and other things that might cause pain and so forth are usually able to be discovered through laparoscopic surgery. Now, the one thing I do tell people is that sometimes when surgeons go in, and I'll always say to people, you need to use an advanced trained surgeon. Advanced trained. They need to be advanced trained. I will say that one more time. Advanced trained surgeon. But when they go in, sometimes they might not find anything. And that's where people panic, because then they come out of surgery and say, hey, they didn't find anything. It means I don't have endometriosis and I don't have this and I don't have that. Actually, no, it doesn't. And I'll tell you why. With endometriosis, you've got to think of things like a little bit like cancer, right? Sometimes cancer cells can be in our body and running around our body, and women might understand it when they go for pap smears, and there can be things like precancer cells there, and sure, they can be detected with your pap smears and things like that. But sometimes you can't visually see things. Some cells are so small and microscopic that you can't see them. It's the same with endometriosis and adeno before it starts to express. And yeah, we get what we call microscopic implants. Now, what happens is the disease is sitting there under the surface and it's causing a lot of inflammation. And I'll show you in a minute. I'll just bring up a picture and just show people what I'm talking about. So that they know exactly what I'm talking about. Now, as soon as this changes over, you'll be able to see it. Here we go. So when we're looking at this picture here, it's showing some of the pathways with endometriosis. Now, as you can see there, we've got the endometriotic implants. Now, sometimes before they express, they're laying there underneath the surface, outside in the pelvis. They could be anywhere, and they might not be able to be seen visually. Now, that doesn't mean that you don't have it. So we often see that sometimes someone will go and have a laparoscope, the surgeon will go in and won't find anything, and then people panic. And I would say, don't panic, it's actually a good thing. We just go off your symptoms because your symptoms are suggesting it. It just means that you haven't got any active disease there at the moment and the disease hasn't fully expressed. And that's a good thing because it's not causing havoc in your system. Sure, it might be causing you pain and other things, but it hasn't expressed to a point where it's spread, it's caused adhesions, it's caused organs to stick together and all the things that happen when it's left too long. So it means that it's in its very early stages. So that's what I'm trying to explain here. Now, as we know, things like endometriosis and adeno, they're estrogen driven. They are not from estrogen dominance. We have to get away from that endometriosis and adenoma that is caused by estrogen dominance. It's not true. Even small amounts of estrogen drive it. Now, as you can see here, there's all these other signs and like activated macrophages and things like that, and inflammatory processes as happens with cytokine responses and that. I don't want to go into that too much because all that means, let's say in layman's terms, there's just a lot of inflammatory processes there. And that's what endometriosis can cause. And also inflammation also drives it as well and makes it and exacerbates it. But when the disease is fully expressed, that's when it's really too late. So if you go in and you see the disease and it's got to the stage where you can see it, like so, I'll bring up, show you what superficial endo looks like. I mean, most people know what it looks like. Here we go. Now, this is straight out of a medical textbook, but I'll tell you what's wrong with this. It's showing the classic red flame lesions and the classic gunpowder burns there. And yes, we can see the disease here. So that can be excised and yeah, and that active disease taken away. But really, those people that we've got, and we know that they've got it by their symptoms, but it's just not visual yet. And that's, again, it's a great thing because it means we can work on suppressing it before it actually does express out more. And that's a good thing before it, as I said, before it creates adhesions and all kinds of stuff, sticking people's bowels together. We don't want that. Sort of a good thing in one way. But again, it could still cause a lot of pain and be ready to express. So think of things like skin cancers and all cancers and all that that can be there, but you don't know they're there, but they're there. But it doesn't mean they're there because we can't see it. So that's the way I try and explain a lot of this. But even this picture is actually wrong. There's actually about 5 different classifications of endometriosis. So while we've got the red color, the black color for the classic gunpowder burn, the red flame lesions, see all that white stuff there? All that white stuff is endometriosis too. See all the yellow stuff up through here? That's all endometriosis too. See those big pelvic veins there? That's part of pelvic congestion syndrome as well. But so the hard thing is, if this was your surgeon and they were taking a picture and saying, hey, here, this is endometriosis, well, they've just missed the heat because they didn't point to the white stuff and go, actually, that's endometriosis. And they didn't point to the yellow stuff. And this is what happens too. It all depends on your surgeon too. And that's why I say use an advanced trained surgeon, because an advanced trained surgeon goes in and doesn't find anything. You know, there's nothing there, but that means active disease. It doesn't mean you still don't have the disease. And you have to go off the symptoms and treat the symptoms and basically say, well, really, based on your symptoms, you do have it, but it just hasn't expressed yet. I'll give you an example of a lap that I've got here. I'll show you. This young lady actually had came in and just saw her mum's OB-GYN and wasn't an advanced trained surgeon, because let's face it, an obstetrician really just does a lot of work around pregnancy and stuff. And a lot, unless they're advanced and they specialize in endometriosis and they're an endometriosis excision surgeon, probably don't have a lot of experience with endo. And this is what happens. And I don't mean this in a bad way either. I'm just telling you the facts. This is what happens. Now, this poor girl, the obstetrician found one tiny little speck of it and said to her, you know what, that one little speck, it's nothing. Don't even worry about it. And she said, what about all my pain? She said, it's all in your head. She said, it can't cause you all that pain. Now, that's not true, because we know even small amounts of the disease can cause a lot of pain. So a stage 1 endometriosis could have a multitude of pain, where a stage 4 might not have any. They could actually be asymptomatic. So the staging system has nothing to do with pain levels at all. None at all. So anyway, this poor girl came and said, look, I think it's in my head. I'm going crazy. I was told that there's anything there. So I then said to her, look, based on all your symptoms, you can't be in pain. It can't all be in your head, and all your symptoms fit into this. So let's go. I'm sorry, but you're going to have to go and see an excision surgeon. So when the incision surgeon went in and looked, and you can see where the first bit was, this tiny bit was burnt, and it was ablated, by the way, which it shouldn't be. So it's left a mark there. But you can see all the white stuff around the mark. That's endometriosis. So that's all been missed. Then on the left there's a lesion before it's expressed. So you can see the endometriotic lesion there. It's not a red flame lesion yet. It hasn't fully bled and expressed and stuff like that, but you can still see it. And as you can see, endometriosis is just normal tissue growing in abnormal areas. That's what it is. Normal tissue growing in abnormal areas. So when the advanced trained surgeon started from that one little bit and started cutting and excising, you can see that it's ended up being this huge big pocket of it. Like, I mean, huge big pocket of it. And this is the reason why people need to see an advanced trained surgeon there was all stuff found everywhere else as well. But this is where, once the surgery is done too, it's not the end of it. It's what I say to women is surgery is just the first component of it. Yes, it can help you get out of pain. It's used as a diagnostic. It's excising the disease that's there. But once you've got diseases like endometriosis, they're there forever. Hysterectomy is not going to cure it. Yes, a hysterectomy cures adenomyosis because adenomyosis is in the uterine tissue, but endometriosis out here, taking uterus away is just going to stop you bleeding. Sure, it'll stop a lot of the period-like symptoms, but it doesn't cure endometriosis. But again, getting back to it all, the real work is then once you've had the surgery is work on suppressing those microscopic implants from expressing further. And that's where the real work and real management needs to be done. And these are all the things that I educate women on and help women find out about and do and so forth like that. So that's why it's very important. But I thought I'd just come on very, very, very quickly and explain to those that have been into surgery, that found nothing. It doesn't mean that there's nothing there. There's two scenarios. One, it hasn't fully expressed yet. It's just in that stage before it expressed. It's there, you've got all the symptoms. Symptoms match the disease, so then you treat the disease as being the disease. Sometimes you can't visually see things when they're not visual. They're microscopic, can't be seen with the naked eye. The other part is you've just seen the wrong surgeon and they've actually missed it all. And that's the other part too. So that's why it's really important to see the right people. And that's part of what I help people do as well, about seeing the right people and helping people along with the right management with it as well. And part of why I've started the experts program as well. So to make sure that we get the right people for patients to see, and those that are fully qualified to be able to do what they're doing. All right, I hope that's explained it all, and thanks for listening, and I hope that settles some people's anxiety around things as well. And remember, if you have been diagnosed and your pain levels are getting up again, it means you're not being managed properly. Go and get managed properly. It's very, very important, and it may even mean that you need further surgery. But you never know, with the proper management, proper treatment, not treating yourself. You can't treat yourself. One thing I always say about, and I mean that in the sincere, honest intentions, you can't treat yourself. Go and get the right help and see the right people and get it sorted. All right, talk to you soon. Bye.